Hello, my name is Marion Crow. I'm a proud member of the Pipot First Nation in Saskatchewan, and I'm the Chief Executive Officer for the First Nations Health Managers Association.
Hello, my name is Andy Aluk. I'm from the Big Stone Cree Nation, and I am a certified First Nations Health Manager.
Welcome to the First Nations Health Managers Association videos that introduce the newly developed Health and Wellness Planning Guide for First Nations. This video was created to offer clear explanations of how to use the Health and Wellness Planning Guide. It was filmed in short modules to allow you to watch a segment, or 2 or 3, or even more at a time, or to use in a team training or in meetings. This Health and Wellness Planning Guide was written for those in First Nations health and includes the voices and the wisdom of hundreds of First Nation health managers shared with us over the past few years. Let me share the dedication from the Health and Wellness Planning Guide. This guide for health and wellness planning is dedicated to each of the hardworking and committed First Nations health managers for whom this guide was developed. Through our work in supporting you, we have seen your dedication, we've heard your stories of strength and challenges, and felt your commitment to help your communities. It is clear that it is love and a desire for change that guides you in your life's work. You may just be one person, but you are part of a network of change makers, and you are making a difference.
Our wish is that the Health and Wellness Planning Guide is easy to use and helpful as you move forward with your health and wellness planning. So let's get started and explore the Health and Wellness Planning Guide together.
We don't need to persuade anyone why health and wellness planning is important. If you're watching this video, you understand how vital robust planning is to your organization and community. So all we'll say is this: your health and wellness plan is your big plan. Quite simply, it is your organization or community's primary document that defines your health priorities, outlines the programs and services which will help achieve your goals, and it identifies how you will measure the progress and success of your efforts.
This is the diagram that captures the key elements of the Health and Wellness Planning Guide. The legs of the turtle represent the key values of culture, community, strength, and quality.
The back of the turtle represents the 7 stages of health and wellness planning. We call them the 7 Ds. The purpose of using the 7 Ds approach is to provide the structure that supports communities but doesn't prescribe exactly what to do or how to do it. Briefly, the 7 Ds cover the following. The first D, discuss the process. This stage looks at the readiness elements of health planning, including preparing your leadership, creating a health planning group, and plenty of communication. Second is design the work plan. This stage helps you lay out your process to create your health and wellness plan. Essentially, your plan to create a plan.
3. Discover the current situation. This stage guides you through an assessment of your community, what your community has, for example, its assets, and what it needs related to health and wellness.
Our fourth is define the priorities. This stage builds on your community assessment and helps you identify priorities based on criteria. And the fifth is develop the draft. This stage is where you create your draft health and wellness plan for the next 5 to 10 years.
And number 6, deliver the plan. This stage is where you take the completed draft health and wellness plan and move it forward for review and approval, so it is ready for implementation.
And 7th, do the work. This stage is where you create the annual plan that will bring your strategic plan to life. You can see how the turtle represents the key elements of the Health and Wellness Planning Guide. In this module, we'll discuss each of the values and the 7 stages that will be covered in the next modules. Let's begin with the values. As we've said, the Health and Wellness Planning Guide has been developed based on values: culture-based, community-based, strength-based, and quality-based. We call them dynamic values because they represent action and empowerment. The dynamic values are not activities, but are ways of working that honor each community's traditions and strengths while inclusively planning for quality health services. The Health and Wellness Planning Guide provides examples of how the dynamic values are demonstrated during each stage to help you integrate them into your planning process. The values are, first, culture-based. Culture can be the underlying foundation for your community health and wellness. This could represent values, knowledge, language, traditions, relationships, purpose, meaning and practices, and so much more. Each community will represent culture in a way that is meaningful for them. Now, some questions to consider. 1. How does culture play a role in the health and wellness of our community? 2. How would we include culture in our health and wellness planning process? The second value is community-based, but also community-paced and community-led. Health and wellness planning is most effective when guided by your community needs and priorities. That means that the planning process needs to include all who might be affected by health services. Because your community's wellness relies on more than health services, other services that contribute to supporting a healthy community would be included in the health and wellness planning process. Understand and follow your community protocols related to engagement and planning. Some further questions to consider. 1. How would we include different community groups and the spectrum of services in our health and wellness planning process? 2. How can we ensure we move forward at a good pace that is respectful of our community?
The third value is strength-based. Each community brings a range of strengths to the planning table. Some examples of community strengths are community members with skills and knowledge, and community history of resilience, effective leadership, and good governance, along with many others. A strengths-based healthcare approach puts First Nation people and their community at the center to take charge of their health and healthcare decisions. It starts from a place of strength, recognizing that all are partners working together to improve health and wellness for the community. A question to consider. Within your community, what are the strengths that help your health and wellness planning process?
The fourth value is quality-based. Quality improvement represents continuous actions that lead to measurable improvements in health services and improved health outcomes for clients. Quality improvement is a purposeful commitment to do things better, which results in progress and improvement. Every community wants their health services to be of high quality. In other words, to ensure a client-centered experience that offers safe, culturally competent, timely, effective, and efficient health care. Some questions to consider. What does your quality care represent to your clients, your community, and your staff? How can you ensure quality is embedded into all aspects of your health services? In the Health and Wellness Planning Guide, you will notice that at the end of each of the stages, there is a section that describes how each of the values might be demonstrated during that stage. The suggestions are direct quotes from First Nation health managers. There are many ways to live your values as you plan. Your community will represent the value in its own way.